Hello, everyone, and welcome. Thank you for tuning in to today's podcast. My name is Gabriéla Versteeg from EFFoST, the European Federation for Food Science and Technology. And in today's podcast, we will explore barriers and enablers for data sharing. Data is one of today's most valuable resources with the potential to improve decision-making, accelerate innovation, and address complex societal challenges. However, sharing data across organizations, sectors, and communities is still not straightforward. Many valuable data sets remain difficult to assess or reuse due to challenges related to trust, governance, interoperability, data ownership, privacy, security, and unclear incentiveness for collaboration. At the same time, many initiatives are demonstrating that these barriers can be addressed. By establishing the right technical solutions, governance frameworks, and collaborative approaches, data sharing can create benefits from multiple stakeholders, including farmers, food producers, healthcare providers, researchers, and policymakers. In this podcast, we explore the key barriers that limit data sharing and the enablers that help organizations collaborate more effectively. Our two guests represent use cases from two Horizon Europe sister projects, and together we will discuss how they are addressing these challenges, building trust, and unlocking the value of data sharing in practice. For listeners who may be less familiar with Horizon Europe projects, these are collaborative projects funded by the European Union where researchers, technology providers, SMEs, startups, and other stakeholders work together to tackle common challenges. A use case is a defined set of these stakeholders who test and apply new solutions in a real-world setting, helping to demonstrate their practical value and impact. And now I would like to go to our two guests of today, which are Eleni Provopoulou from Netcompany, representing the EU project FoodDataQuest, and Dolores Ordonez from Any Solutions, representing the Data4Food2030 project. Welcome, both of you. I hope you're fine. And thank you for joining this podcast. So, Elena, I will start with you. In the project FoodDataQuest, you represent use case 2. Can you explain briefly what the use case is about and why does data sharing matter in a hospital food service setting?
Hello from my side as well. I'm representing Netcompany, which is one of the huge players on ICT in Europe. And in FoodDataQuest, we are leading work package 2 and use case 2. More specific about use case 2, use case 2 is taking place on the University Medical Centre of Maribor in Slovenia. And what we are trying to do is that until today, the hospital is using only paper for tracking some data and proceeding with some processes. So apart from digitalizing the total process, we are trying to combine and correlate all these kind of data that are coming from different data sources, for example, the kitchen, the nutritionist, the patients, and the health doctor as well, in order to analyze them and proceed with some predictions and analytics regarding the total process.
Thank you. And Dolores, also welcome from Any Solutions. Can you give an introduction of the i4 data pilot in the food data for Food 2030 project?
Yes, thank you. Thank you so much for inviting us to participate in this very interesting podcast. So Any Solution is a company located in Mallorca in the Balearic Islands, and we are participating mostly in projects related to tourism and agri-food. And for us, what it's important is to generate these synergies. So in Data4Food, we are leading this i4 data pilot in which we're working with two main sectors, mainly with the almond trees and with the wineries. And we are going to we have concentrated more in the winery sector because in the island of Mallorca, although being so small, we have 80 kilometers from one side to another, we have more than 100 wineries, and they are feeling that all this new era with data is a great challenge for them. So how can we better help them to understand which is the power of data to take better decisions, to be more efficient, to commercialize better their products, but at the same time to generate synergies with the other very important sector at the level of the Balearic Island, which is tourism.
Thank you, Dolores. Okay, then I would like to go to a little bit more deep dive into the use cases. And I would like to ask you some questions. So, Eleni, I can imagine when you propose sharing data, private hospital food service data across departments, I think that goes from kitchen to clinical nutrition to procurement. What is the first objection that you hear?
The first objection that we faced and the first concern is almost always the privacy and the governance of the data. So what we did is that hospital stakeholders immediately ask whether the patient information will be exposed or further shared and with whom. So what we did is that we tried to define who will have access to which data and whether data sharing complies with GDPR and the hospital internal processes, of course. And another concern, and common concern, is that the operational data, as you mentioned, such as procurement, kitchen production data, or food waste data, may reveal internal processes or inefficiencies that departments are not comfortable with sharing. So what we tried, and the main objective also, was not to centralize sensitive information, but to enable secure and, of course, controlled data sharing.
Okay. You already mentioned shortly patient data. That is among the most protected private data. How does your use case share useful insights without exposing individual patient records?
We are protecting first, of course, patients' privacy, because this is something fundamental for the principle of our use case 2. So the FoodDataQuest private data sharing framework, which has been created in terms of work package 2, is designed so that all the sensitive patient information never needs to be broadly shared to generate valuable insights. And what we mean by this is that instead of creating and sharing private data, we created a dashboard that processes data in a secure environment and also present all the aggregated indicators, trends, and analytics rather than the individual patient records. So all the personal identifiers are removed or pseudonymized, where appropriate, of course, and only the minimum data required for the specific analysis and the reports that we need are processed. So, generally speaking, we can say that this process allows us to improve nutrition management, monitor food waste, and also support the decision making from the director of the hospital side, while remaining fully aligned with the GDPR and hospital governance requirements as well.
Sounds very interesting. So what kind of private data goes in, and can you give an example of what kind of insights come out of this dashboard, and who is allowed to see it? Can everybody have access, or is it certain aspects that are limited to certain people to view?
Mm-hmm. So I will give a general example. Just think that we don't use personal data, for example, Eleni Provopoulou, etc., etc. We provided some numbers to the patients, for example, patient 1, 2, 3, etc. And to better understand this, I will give you a more specific example regarding patients' nutrition monitoring. So let's imagine that the dashboard receives some private data, let's say patients' dietary requirements, prescribed diets, or meal consumption records, and aggregated food waste data collected from the specific meal services. And all this kind of information is securely integrated and analyzed to identify different patterns, such as meals with consistently high waste or patients who may be at risk of any inadequate nutrition intake, etc., etc. So Regarding the access you mentioned earlier, the access is strictly role-based. So the healthcare professionals involved in any process of the patient care can access only the information necessary for the responsibilities, while the managers of the hospital and any other decision makers can view aggregated dashboards and KPIs and general analytics. So personal patient data remain, of course, protected through the GDPR compliant measures, such as data minimization, the pseudonymization of the data that I mentioned earlier, and of course, the control access permissions are all these kind of measures that we are taking in order to ensure that each stakeholders only sees the data that they are authorized to use and see.
Okay, thank you. Clear. So I think many organizations, and I assume hospitals as well, they often have their data locked in departmental silos. So from your perspective, what has been the hardest barrier to overcome? Is that technical interoperability or data quality or the formal agreement with the hospital and health authorities or any other example?
The first barrier we faced was, first of all, to digitalize the process. It was something we had to face from the early stage. And of course, the biggest challenge in any hospital is the valuable data that already exists, but it is not spread across independent systems that really communicate with each other. So in our use case 2, the dashboard addresses this through a combination of semantic interoperability, common data models, and of course the standardized interfaces that our team created. So rather than moving all data into a single repository and just store them there, let's say, what the FoodDataQuest dashboard is doing is to create a trusted framework where all the different systems can exchange only the information that are necessary and required for a specific purpose. So the semantic data model is used in order to ensure that all the information coming from different departments has the same meaning. This is very, very crucial. And also, at the same time, governance policies and role-based access control, together with GDPR compliant procedures, of course, ensure that each department retains control over its own data.
It's quite a complicated structure. I think you have to operate in parallel all these different aspects. So can I ask you, where does the pilot stand today? What phase are you in, and what private data is already being integrated?
So today we are happy to share that we launched the first and initial version of use case 2 dashboard. And now this dashboard is available for validation and data integration. So this first version of the monitoring dashboard has been deployed, and all the food waste data collected by the hospital side is already integrated and visualized. And at the moment, we are expanding the platform to include more information in terms of the nutrition part and meal planning, and any additional dietary information which will be useful for the final reports. While at the same time, we started the initial pilot validations phase. We shared the codes and the passwords and gave access in general to the hospital staff to test the environment. And later on, we will proceed with some updates. And also what we want is, as the final step, that the dashboard will demonstrate how the FoodDataQuest framework in general can support secure and, of course, trustworthy data sharing in a real hospital environment.
Thank you very much. Then I would like to go to Dolores. Dolores, you always gave some insights on the use case that you're working on or you're involved in. So when you propose sharing private production or winery data across cooperatives, appellations and partners in the Balearic Islands, what is the first objection that you hear?
Okay, so the first thing that we try to do is to explain about the project. So because I think it's very important to explain that we are in the framework of an European project. This means that the European Commission have approved this project, and we have like this kind of branding in order to start generating the trust that we are generating. We are working in this trust environment, and I think this is the first step. Then we explain that we wanted to boost this data economy. And of course, when we started Data for Food, data spaces were still a little bit something new. Not everybody was very aware what was this about data sharing in this framework of data spaces. But at the same time, in the wineries, the wine sector in general, they have a very specific regulations. So they really need to send all their data directly to the regional government and to the national government. But this is not a real data sharing. They are just gathering all this data from the wineries and then sending directly without generating any added value. This is compulsory by law. So the first thing that when we had this first meeting and we asked them, okay, we really want to help you to understand which is the importance of sharing data, which is the power of this data. If you share it, how can you generate more value about sharing this data? It was, why do you want our data? How complicated is going to be? Are we going to put in place new procedures completely different to the one we already have to send all this information to the regional government or to the national government? So for them, there were like these two main big questions. So why do you want our data, and what are you going to do with our data? And then, is this going to be an overload of work for us in order to share this data? So for them, these were the two main challenges or problems that they saw at the beginning.
Yeah, and I can imagine that for the use case that Eleni is working on, it's more silo-based and the privacy concerns, while for the farmers and the cooperatives, the production data is commercially sensitive. So both are sensitive, but in a different aspect. So how does i4Data, the pilot, share useful insights without exposing individual farm or winery records?
Yes, the first thing was to explain then that we are not interested in knowing these secret formulas of the coupage of the wine. So I think this was very important to explain them exactly that when you share data on voluntary basis. So you really need to share this data that you consider that it's important for you to share it, to get a new knowledge, to generate more efficiencies, to be more competitive. So once this was clear, because at the end of the day, there is a lot of data related to production, the typology of grapes that you are using. If you are an appellation, it is compulsory by law that you use a percentage of grapes that are from the island, that are in an autochthonous area. So at the end, those are things that are already quite well regulated. But for them, it was also very important to know how to better commercialize their wine. So because at the end of the day, most of the wine that is produced in the Balearic Islands is sold to countries as Germany, the UK, the Nordic countries. So at the end, there is a competition among the wineries on knowing better the clients, how can we better sell our products. So if we give you all this information, perhaps we are losing some part of our competitiveness. And this is something that we really try to help them to understand, that if they know better the clients, the preference of the clients, where the wine is being sold, at the end, they are gaining a lot of knowledge on the market. So they can better adapt the prices, the products to the preferences of the clients, and they can be more competitive. So it was like a kind of process, but it was clear from the very beginning that the most important part that for them was the coupage of the wines, was not going to be shared.
Yeah, thank you. That's clear. So the same question as to Eleni. So you also have you collect data from the data you create insights. So can you give us an explanation of what insights you gather from all the data you collect, and who is allowed to see it?
Yes, so we create different functionalities for the dashboard. So on one side, this was more from the commercial point of view. So we just close data coming, for example, from Airbnb reservations, so the bookings and where the wineries were located. So for them, it was easier to see where the potential clients were. So because there the wineries were not aware about the number of people that were surrounding all the wineries that were potential clients for wine tasting, for visits, and also to sell their wine. So this was an exercise that we did, and it was very, very interesting for them. The other one is that we have created also some QRs. These QRs are located in all the wineries. When the clients goes to the winery and they make a wine tasting, a visit, or they go just to buy some wine, they can fill in a very short survey that is in the QR, in which we have already reduced the number of questions just to take 2-3 minutes to fill it in. And then with all this information, we generate a lot of insights to the wineries. So the satisfaction, but also which typology of wine they want, if they are repeating or not in Mallorca or in the wineries, which is perhaps the trends that we can see in the market, if it's more sparkling, more white wine, or wherever. And then they can know better also, they can get more information about nationalities, about age, about gender, this kind of information that they were lacking. So we have generated 2 spaces in the dashboards and also in the data space. So at the end, there is a private area in which only the wineries have access to this information. And then is the public one in which everybody can have access, in which we are also including public data available from the regional government or from the statistical institute. I think this is very important because for them, they keep also the privacy. And indeed, there is one part of the dashboard that in which we generate also insights for each winery. So, and this information, it's only for each winery, and the winery decide if they want to compare with the other winery based on consent. So we have signed different agreements with the wineries and with the cooperatives in order to generate this trust, which is the most important part when you are generating data spaces. So based on trust, in order that everybody feel that they are playing all with the same rules.
Thank you. And you already sort of answered my my last question to you, like what was the hardest barrier to overcome? From your story, I hear it's building trust and formal agreements. Was that indeed harder than the technical interoperability or data quality? And did that take the most efforts from your use case?
Yeah, it was a little bit. It depends on the winery. There are, of course, some wineries that are very advanced, so they have all their information, all the data already digitized. There are other wineries that are still working with Excel files, they are not so digitized. So it was a kind of process in which we try to harmonize all the ways in which we are gathering all this data. But at the end of the day, the first step is to generate trust. To have the meetings with the cooperative, to have the meetings with the winemakers, to have also the support of other entities, because we have the support of entities as the cooperative, the Chamber of Commerce, the regional government. We have generated not only these bilateral meetings, but also group meetings and events in order to explain how we are working. And at the end of the day, this is a process that it will continue evolving. We are not working with all the wineries all over the island. This is our next step in order to try to involve all of them and also to connect them better with the tourism sector. Because at the end of the day, we have a lot of tourists coming from different places. They they are not all aware about the wine production at the level of the Balearic Islands, and we consider that this is very important in order to promote the sustainable tourism, more slow tourism, and the people knows better which are the local products of our island.
Okay, so you tell about some future plans, but where does the pilot stand today exactly? So what phase are you in now compared to the total project and the end result?
Well, when we started with the pilot, we were more discussing about data economy and the generation of dashboards, and these dashboards to generate some insights to the wineries. Once the project was evolving, it appears this part of the data space. So we are very lucky because we are also partners in SEEDS, which is the Common European Agriculture Data Space. And in SEEDS, we are going to continue developing this part of the data space in which we are going to have this the onboarding, the catalog, and all these different parts. And also what it would be great is that if we generate the catalog of the data space at the level of the Balearic Island, it would be also federated with the catalog in SEEDS.
Thank you. Yeah, I think that was a very clear introduction of the barriers and the potential solutions for data sharing. Now, of course, I think there's still a big world in front of us and needs a lot of work. Do you, and it's a question to both of you, do you have any recommendations for other data sharing initiatives on how to share data when doing so might negatively affect the data sharer? Is there like a built-in mechanism for the framework that can help? How do you see that? Can I start with Eleni?
Very nice question. So, and very useful as well. So from our side, one of the key lessons we learned is that organizations are much more willing to share data when they remain in control of it. So what I mean by this is that, generally speaking, our recommendation is to avoid sharing any raw sensitive data whenever it's possible, and instead focus on sharing only the information that is necessary to achieve the intended objective. What supports us to proceed with this is, of course, setting from the beginning the framework that our project is based on, and this framework is incorporating several mechanisms that support this approach in general. So perhaps the most important recommendation is to treat governance as a collaborative process rather than the purely technical exercise. When you are engaging data providers from the beginning and you are transparent about how their data will be used and jointly define any rules for data access, this is something essential for creating confidence between all the stakeholders. And in our experience, organizations are far more willing to participate when they understand that the total framework is designed to protect their interests while still enabling valuable collaboration and innovation for all the involved parties.
Thank you. I think that's a very concise and very nice answer. Dolores, do you have anything to add, or?
Yeah, well, I completely agree with Eleni. I think just to add a little bit more is to start small. When you are entering in a sector or in a group of entities that they are not used to participate in this data sharing initiative, they don't know what is a data space. So perhaps sometimes we are in a kind of bubble that we use this terminology that for us is very common, but when you go outside of our bubble, not everybody understands what is a data space. They don't understand why data sharing is for. But when you try to identify which are their main pains, which are their challenges, and you show them from a very clear way how by sharing data they can start solving or finding some solutions for their problems, I think this is the best way to demonstrate why data sharing is so important. So the building of trust, as I mentioned, and then also to start small, to start really going to these specific challenges that they have. And once they are used to share data, because then we are speaking all the time about sharing data. But the first step is that if everybody is ready to share data, because perhaps their data sets are not ready to be shared, they are not well structured. So there are some steps that we really need to check. And sometimes when you go to a place, oh, you have to share data. And for them, it's going to be a very big ball. So it's going to be a very big problem in which they are seeing a lot of problems. It's going to affect their day-to-day. They are going to make investments because sharing data is not for free. So at the end of the day, I think those are the things that we really need to understand, and those are clear recommendations. And then perhaps not everybody is ready to share data. So perhaps data intermediaries are going to be every time more important in order to have this role with the very small entities that wants to share their data, but they don't have the capabilities or perhaps the technologies to do that.
Thank you. And you also mentioned an interesting aspect, which is to define which are the pains of the cooperatives or the end users, the ones that need to provide the data. Why do you provide your private data? Eleni, I can imagine that in a hospital setting with working in the different silos, that is also the case. So how did you approach that to convince the different departments of the current pains, and what the gain would be by going through this process of data sharing?
Actually, it was very helpful when we had the first meeting in the hospital, and it was very helpful because all the team understand the flow regarding the meal serving process and all the process regarding the meal preparations and the meal distribution as well. So what we understand from the beginning was that the hospital staff is requested by their own to digitalize and to correlate as much as we can the total process, because they understand from the beginning the total benefit that this will bring to their everyday life, and how easy will make their daily work as well, apart from the reports that we are sharing with the director of the hospital as well. So it was an easy process for our case, because they understand from the beginning the benefits of having a dashboard and correlating all the different data from different departments. So apart from this, for the first stages that we are running at the moment, what we did is to focus on one department. As Dolores mentioned earlier, it's very important to start small. So we decided to start with a couple of departments in order to test the dashboard as well. So further on, we want to enlarge as much as we can and of course to make even better the total process in order to support not only one hospital, but many hospitals under the same country as well. This is our big vision, so I hope that we will manage to achieve this by the end of the project.
Thank you. Well, that was also going to be my last question to you, because there will be more podcasts and I don't want to give away everything. But looking ahead, what would success look like for you? And it's a question to the both of you. So what is the ultimate impact you hope to achieve through your work on data sharing and data spaces? And I can imagine, for instance, for Eleni, for you, if this concept stands, if the dashboard stands, how great would it be that it can be scalable to other hospitals, to other countries? And for Dolores, I know that there are so many cooperatives worldwide, agriculture cooperatives. If this is a concept that can be copied and shared with other cooperatives. But don't let me answer my own question. I give the floor to Dolores first.
Well, for me, it would be great not only to involve more cooperatives working only in the wine sector, but with any other product, and also to generate synergies with other sectors. Because at the end of the day, working with tourism, we have seen that it can generate a lot of advantages for the agricultural sector, but at the same time, agriculture is fighting a lot with climate change. So all the data that is coming also from the Green Deal data space. So these synergies that can be generated with the different data spaces, I think this would be the great success in order to allow that data flows whenever whichever the data space in which we're working, and also that the farmers, the cooperatives, can really benefit from this data sharing. So they really understand why data is so important, and also they have easier access to it. So we are always saying that we're speaking about data spaces, but perhaps what we really need to start working is how to simplify the ways in which small actors can participate in the data space, because I think this will be the great success.
Thank you. And for you, Eleni?
I will give you an example in order to answer this question. In 1987, American Airlines saved more than $40,000 per year only by removing only from the salads they serve to the first class passengers. So you can understand how important it is to make some decisions and how we can save some money. So our target is not only to support the Hospital of Maribor, but also and support other hospitals as well. Our vision is also to support any healthcare center. And of course, in terms of scalability, it would be nice if we can enlarge the dashboard so that it can be used in schools as well, or maybe in hotels, or even more in airlines and other companies in general. So we are starting small, but our vision is to have a general impact in European citizens and world citizens as well.
Thank you very much. And I think I really appreciate both of your ambitions and your goals. Thank you again for all your input and this nice conversation. And I really hope that you will succeed in your ambitions. And for the listeners, more information on the two projects can be found on the websites www.FoodDataQuest.eu and www.Data4Food2030.eu. And with this, I would like to close this podcast. Thank you all for listening.